So we are having a webinar today, which is entitled Care in COVID Times. And Seva at Home brings you this webinar. Let me tell you a little bit about Seva at Home. Seva at Home is an organization which is based out of Delaware in US. And we've been in India now for a couple of years. Seva at Home started out with a personal journey of one of the four founders of the organization, three of whom are non-resident Indians, and one of them is an American. In 2016, one of the founders went through a personal tragedy. He used to work for a company called Alex Partners and based out of Boston, and would travel to India to look after his ailing father. His father was suffering from cancer. In 2018, when Mr. Atul Gandhi lost his father, it was then that he quit his job and decided to launch Seva at Home. He realized that there's a need for remote care in this country. There are so many of us living away from their parents. Some are living abroad, some are living in India, but in different cities, and the elderly have to be taken care of. So, with this aim, Seva at Home was launched, and since then, Mr. Atul Gandhi has joined, brought in like minded people together. And four of such people are on your screen. These four remarkable ladies are just a handful of the many women that we have in the organization. So on some platform or the other, you will meet the others as well. But they're doing an excellent job in bringing in care. And today in this webinar, we're going to talk about care for the patient, care for the family members who are going through that, agony when there is suffering at home, care for the caregiver, the attendant, or the nurse who's called at home to look after the patient. This amazing work-life balance that these women strike, and we've gone through some of their personal experiences, which we will share with you, and we will learn from that. There's also this role of people in the family, and last but not the least is self-care. As they say, in the aircraft, if there's a fall in cabin pressure, an oxygen mask will fall first. Take care of yourself, and then you'll be able to take care of other people around you, including children. Self-care is extremely, extremely important. And then, of course, there are these healthcare workers who come home and who are actually working all the time to support these patients. As someone very rightly said, someone asked, why are all the temples closed today? And the answer was that it's because all the gods are down there in the hospitals wearing the white lab coat, looking after patients. So, with that note, let me introduce you to Brinder Goraya. Brinder is a non resident Indian. She's based out of Boston. She lived in Delhi, grew up in Delhi, was a student in the Delhi University in English literature, and then went on and settled in the US. In the US, she started two franchises, uh, Mrs. Fields' original cookies and the country's best yogurt. She enjoyed that work, did that for many years, found it very exhausting, and then quit. Ran into Atul, who had this wonderful idea about Seva at Home, liked it, and here she is with us. On the screen, you will find Bindiya. Bindiya was working with Deloitte. She was the manager of special projects, also looking after training and development for 11 solid years. And then she quit and was at home bringing up children for 8 years. She decided to come back and serve people. So welcome, Bindiya. There's
Thank
Poonam
you.
on your screen. Poonam is Masters in HR from the University of Melbourne in Australia. She was a manager, general manager HR with Vedanta. She heads HR at Seva at Home. Uh, Welcome, Poonam.
Thank
And then
you.
there's Jaya Sukul on your screen. We call her So Cool. She's been doing a lot of stress management webinars for us, and she's just the right person to be here. Some of you would have already met her in some platform or the other where we've been talking about how to manage stress. She's a doctor, clinical psychologist, a licensed clinical psychologist. She's the head of the Department of Clinical Psychology in QRG Medicare Hospital, Faridabad. She also is a visiting consulting faculty in a lot of hospitals in NCR and has a private clinic of her own in Ghaziabad. She's a founder of a company called Pro Garden, which is India's first and only clinical career counseling initiative. And when she's not doing all of that, she's working with us at Seva at Home. Just the right person to be with us. And we will, of course, pose to her question on how to, cope up with this anxiety which is related to stress. So let me begin with you, Brinder, by asking you about your experience, you know, of being an NRI, and then during this pandemic, how did you, manage this emotional toll? What was your experience?
Hello, everyone. Um, Thank you for that good question. Being an NRI, I think, has never been as difficult for me as it has been in the last 2 years, honestly speaking. I moved to US about 2 decades ago, and life has been good. Obviously I have missed my parents and my family and sibling and everybody from India, but there was never a fear that I don't know when I'll be able to see them. There was never a fear that what if I'm not able to reach there in time. And now my parents are aging, and obviously that question is always in my mind: will I be there to take care of them or not? The last year put all those fears back, and how, really, really strong. The first time we heard about coronavirus was March of last year. And the instant thought, like many NRIs we had, was like, oh God, I wish it does not hit India as bad as it hit USA. Because here we still had the infrastructure and everything. And we were very, very fearful about how it will happen, how India would be able to cope with such a thing. We were happy the way the first wave was, controlled by everyone in India, and the lockdowns and everything were very good. And so we were, a little more comfortable here. But then came February, just 2, 3 months back, and the fears came back really, really strong. And it has not settled in yet. I've never had anxiety in my life, and now I do. I've never felt the word homesick as bad as what I'm feeling right now. And every day, the news and everything, talking to my parents, I make sure that I FaceTime with them every day, every
Your
single day.
voice is cracking. Are you able to hear, the others are able to hear Brinda?
Yeah. Yes.
Yes.
Okay. Should I continue? Am
Yeah,
I?
go ahead, Brinda.
Okay.
I maybe a problem at my end. I was just
Okay.
wondering.
Okay. Yeah. So it's been stressful. I mean, this highly transmissible Indian variant of coronavirus has, I think, caught all of us off guard, whether it was in India or all of us NRIs. And I think I'm speaking on behalf of all of the NRIs where we are fearful of, I don't know when the flights are going to open, and God forbid, if I need to be there, will I be there? So it has definitely taken a toll on my sleep patterns and my anxiety, and I'm always on the edge a little bit. I try to calm down, but I think news and everything are kind of scary. And I'm from Delhi, and Delhi has been hit the hardest as of now, and it hasn't been a pleasant experience for, I know it's bad for you all in Delhi, but I think it's the emotional toll on not being able to be there and just listening to the news has been immense on all of us. NRIs, yeah, pretty much that.
Yeah. So, what would you wish to tell other NRIs who I'm sure are in a similar stressful situation as yours?
Unfortunately, I don't know how to give any good advice, but I'll tell you what works for me to take my mind off is I've always practiced yoga. Now I don't miss a day. I make sure that even if I don't feel like it, I get on the mat and I just meditate. I'm learning how to meditate. And I think that has kind of helped me a little bit. We were not in a strict lockdown in the USA. So, and I live in a society where I'm able to take long walks. So I put my music on, I go for a walk, and just even if those 10 minutes I'm able to distract my mind, I think that helps me a little bit. Before I sleep, I try not to read the news. It's a deliberate, conscious effort. I used to be on my phone in my bed all the time, going through everything. And now even a WhatsApp is scary. When I'm talking to my friends in India, everyone has some kind of a loss and they are grieving, and it just starts to beat my heart so much more faster, and I am unable to sleep better. So I've tried to deliberately take that away for at least half an hour to all my NRI friends or fellow people. It's just, I don't know what to say, but it's just we have to take it one day at a time. That's the only way that helps. My mantra has always been, this too shall pass. And I pray that this too shall pass like really, really fast for us.
All right, we'll come back to you, Brinder. I mean, just to ask you, Jaya, because you're in a different role today. You know, you've as an individual have gone through a lot, because while you've been occupied with a lot of work, you live in a joint family and you had a lot of cases at home. And how have you been dealing with this? And what do you have to say, especially after hearing Brinder?
I think the first thing is that, we have to accept it at some level. I think the anxieties are perpetuated because of a lack of acceptance of the situation. I live in a joint family with like 14 members in the house, all of them positive except 3 of us. And then losing a couple of people in the house was also very difficult. And the only thing that I anchored in my head was the fact that, okay, I am getting unpleasant emotions, I am having these negative thoughts, but these are the most normal thoughts that I could have in such a situation. I was not expecting myself to be positive. I was not or wanting to be positive, or wanting to be the stone-hearted caretaker of the family. Whatever emotions, I did not falsify them. And I think that brought me a lot of peace, that making peace with the unpleasant emotions and understanding in a normalcy. Like, if you go to a funeral, you're supposed to be crying, you're not supposed to be laughing. So just making peace with those unpleasant emotions was the first thing that I could do to keep myself level-headed and strong, and so that I don't go in the way of myself. And on when we're talking to people, I'm not creating a sense of paranoia, but there's just adequate vigilance. Have you been able to hear me?
I was just wondering if the problem is at my end or your end,
No.
because I was not.
Okay.
Did you hear?
Dr. Jaya.
Did
Okay,
you
so
hear, Jaya?
all I was saying to finish that was that let's not create a paranoia, rather just a healthy level of vigilance when it comes to us and our family is something that will save us. The paranoia or the excessive vigilance is the one that's going to damage us mentally, physically, exhaust us completely. So let's hold on, understand that these are normal emotions, these are unpleasant emotions, we have to live with them, and let's not be paranoid about the illness. Like, just be vigilant.
Yes. Bindiya, you yourselves went through the experience. You suffered from COVID, and so did some of your family members. Just take us through that experience, and how did you cope with it? What were your thoughts when you were not well and you had to be quarantined and so on?
So, so I think the initial reaction to, when I had a sore throat was, I can't have COVID. It's not COVID. And I kept telling myself, I have not met anyone who has, who tested positive. So that was my first reaction. And so the first day when I had a sore throat, honestly, I just thought it's just a sore throat, and I just left it at that. And the next day when I got fever, I was like, okay, so this combination doesn't look very good. And I think that is when that's when we called somebody to test. Now, looks like the timing of my illness, or rather when I tested positive, was quite a tough time in Gurgaon. I live in Gurgaon, so it was really tough. And that time, the guy to come to test also took like a day and a half to come to take a sample. And so when I got fever, I quarantined, I isolated myself and I locked myself up in my room. But the first thought as a mother was, what are my kids going to eat? I think honestly, that was my first thought. And so thankfully, my in-laws live close by. And, I think they were also, that was their first thought as well. Oh God, Bindiya is unwell. So, what's going to happen to the kids? And my husband was there to take care of me, but he wouldn't be as good as me with the kids. So my in-laws were great. They came and they took my kids with them. And then 2 days after that, both my in-laws, their cook and their driver and another staff member they have also tested positive, or rather also started showing symptoms. And and my husband's reaction, he was like, oh gosh, now what? So he was like, because my children will not sleep, or rather at least my daughter, who's just 3.5, will not sleep without me. So the first reaction for him was to protect the kids. He's like, oh God, there also everybody is positive. I'm going to bring them back here and I will take care of them no matter what, So I think in a way he progressed as a father. And then with mom and dad and everybody else there, with everyone being positive, I think, he was the only one, strangely, that tested negative. And thank God we had him to take care of everything in both the houses. So I think through this whole thing, I've, of course, there were extreme lows. And I think, I practice Buddhism. So, like I was listening to Brinder, and, like I think each one of us goes towards everything that we have in our lives that's positive. So I think my practice helped me think and focus on the positive side. And I think a few days into this whole thing, we found out that my father-in-law's infection was, like it had gone to his lungs. So he got, in fact, he's still in the hospital. And his saturation levels were dropping, drastically. So I think, I might have been in isolation for about, say, maybe 10, 11 days. So I hadn't finished that full 2 weeks, but I had no choice, because, my husband had to rush to figure out oxygen, to figure out, like, okay, where can we get a hospital bed? I mean, in these, it's been 4 weeks since all this has been going on in our house. And I think everything it's been a challenge, like things like even medicines, it takes like at least 24 hours. So, I can imagine the anxiety that Brinder is going through, and having gone through all of it, I think that helplessness is what I did not like through this whole thing, because it's not in, like I mean, as much as I wanted to help, and as much as I wanted to, sort of just make that oxygen cylinder appear, it didn't happen. But again, my practice made me realize and feel gratitude for all the lovely people that came forward to help. I think the one thing that I saw during these last 2 months is how everyone is trying to help, people. I spoke to people I didn't even meet during this time. I had people calling me, oh, I believe you need an oxygen bed. Oh, I believe you need an oxygen cylinder. And I think we might have a lead, which was just beautiful. So, I think I tried to focus on this as much as I felt helpless, when I was trying to organize for things for my family. I think that's what my ride through this whole thing has been.
Thank you, Brinder. Those were extremely beautiful thoughts. Poonam, you did not have a COVID case at home, but there was a medical emergency, I know. So, can you describe that situation and how you felt and how did you cope up with your situation?
So the first reaction when my father was unwell in the middle of the night at 3, my instant reaction was, I hope it's not COVID. Yeah, because the symptoms were such stomach and sweating. So just the opposite of what Bindiya said, that she thought it's not COVID, and my instant reaction was COVID. It was a bit of a at that point, I think I was a little angry as well. And I said that if it's COVID, I'm going to be very angry with him. He had gone out 2 days before the curfew. So that was the instant reaction. And then luckily, it turned out, unfortunately, to be something else. So luckily, not COVID, but unfortunately, it was a more serious problem. His blood reports were not very good after we got it done. So yes, we had to get we were told to get an ultrasound done for him because he had a serious problem in the abdomen area. We decided not to do so because of COVID. A big mistake. We should have got it done when the doctor had prescribed it. But because of the COVID fear, I think my father just had to suffer for extra 3 or 4 more days. So while fortunately he was not suffering from COVID, during COVID times, we had a rough time with him and we gave him a little bit of rough time.
Did you get a COVID test done when you were back home? Because you were in the hospital, right?
So for the first 3 days, when he was unwell, we did get to consult a doctor, and this doctor did prescribe a medication, and he was fine for those first 3 days. On the 4th day, he developed fever. It was 100 degrees. And that's when we panicked. We said, okay, now this must be COVID. And let's all, so the whole family, we went and we got ourselves tested. And fortunately, it was negative. We got both rapid and RT-PCR just to be on the safe side. So we did get COVID test done and it was all clear. Following which we did consult doctors. I think by that time, my father was also willing to explain what the problem was. But in the first 2-3 days, he just kept saying, I have an upset, I'm uncomfortable, there's discomfort. So he was also not able to explain. And I think at the back of his mind, he was also scared that it was COVID. So he was trying to avoid telling us all the symptoms or all the discomforts that he was having. And but luckily it was not COVID. Then we consulted his urologist. The urologist was very clear. He said, this is not a urology problem. It's definitely a gastrointestinal problem. And then we got the blood test done post that, which were really scary. And then I'm very fortunate that my aunties are doctors. We have doctors in the family. And the moment I sent the blood report to my aunt, she got so scared and she panicked that she sent the report to my other aunt. And then she called me, and I still remember she called me around 8:39 at night. And she said, you have to get an ultrasound done of the stomach, of the abdomen. And I said, I can't go. It's COVID time. We are scared. She said, no, I'll have a friend of mine help you out. And around 9:10, my aunt called her friend and he opened his clinic just for us. He did the ultrasound and then we found out what the problem was. There was one doctor that I know very well and she was very kind. She was in touch with me. She helped me connect with a doctor at a super specialty hospital. And then we were able to, get a bed. Very next day, we had to go to the hospital. So yes, we did get COVID test done and it was good, but then it led to another problem.
Talking of beds in the hospital, I'm tempted to ask you, Brinder, what were your expectations from the hospital when your dad was hospitalized?
So my father wasn't hospitalized for anything related to COVID. I think the timing was just, there's no right time to get COVID. I think my brother got COVID at the worst possible time. So my dad was in the hospital for his knee replacement surgery. And this is March end. So by then the peak hadn't come in India. I mean, it was scary. I mean, I had a second thought in my head where I wanted him to postpone his surgery so that I'll be able to, be in India, and then the COVID wave would have gone down, kind of a thing. But I think he was in a lot of discomfort. So he was like, no, I think I need to get this done. So the first instant, and I told my brother also, I'm like, be careful, because hospitals are like, the areas where you could get COVID, because, there are many, many more cases. So while dad had just done his knee replacement surgery, that is the day I was FaceTiming my brother in the hospital. He's sounding, he's sneezing, his eyes are watering, and he looks all red. And my first thing is, I knew it in my gut. I don't know why. I said, I think he has COVID. And the first thing I told him, I was like, you don't stay in the same room as dad. I fear you have COVID. And he's like, no, 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 there's some construction going on around our house. It's an allergy. As Bindiya said, the first reaction is to say, mujhe kaise ho sakta hai? And that's exactly what he's like. I haven't gone out. I always wear a mask. And he's a germophobic. He even sanitizes walking from one room to another inside the house. So for him to be positive was like, we were all shocked at that time. And he did, so I sent him home. He was home and he tested positive. And I think that is when it really hit. I hit my low at that time, because here's my father who has a knee replacement surgery. My brother is the sole caretaker, and he has to be in the other side of the house. And there were days where he would say, don't be so sad, because I am in the same room, in the same house, but I cannot even go say hi to them. So what will you do coming all the way from USA? So it's like, I think that was the toughest time. And fortunately at that time, getting a bed in the hospital and all those things were not an issue in Delhi by then. I think that all started in April. And I think if one good thing I have to say came out of it was like, whatever had to happen happened March end for us. And April, now father's recovering well. My brother is recovering well. I mean, he's all good now. I have to give out a shout out to my Seva at Home team, because I call them in panic. I'm like, I need a caretaker for my father. And my lovely team of all these people and everyone who's not here on this platform today, backstage, they all helped me. And I was able to get somebody within a day. And that's when I was like, okay, now I'm okay. Someone's there to take care of him. Someone's able to hold his hand, walk him through, give him his medication. And you know how parents are, they usually will never tell you how they're feeling, because they're like, oh, what will you do? But I was able to talk to our caretaker, Kulbir, and that's a good thing about Seva at Home. You can have that access to talk to the caretaker and ask, did my father eat well? Did he take his medication? And that kind of helped me relax a lot. So yes, shout out to Seva at Home.
Yeah. What was your experience with home care, Bindiya? Because we're talking about home care, and I thought it'd be good to ask you that.
Yes. Yes. So my experience with home care, initially the first provider that came, I think was not so experienced, and she was actually in place of somebody else who came, and so we were very patient with her. I guess when that home care person came, we were also quite clueless as to what to do with her initially, and that's my daughter. I don't know what's happening.
You can take a break and come back. And
then I just get 5 minutes to just calm down. I'm so sorry.
Yeah, that's just fine.
Yeah, just 5
you can
minutes.
do that. Yes, you can do that. Let's talk about. We will come back to her experience with home care. Let's talk about vaccination. Brinder, is your family in India vaccinated?
So my brother and my mother just got vaccinated. my father, we don't want to take a chance with him because he's just recovering right now. What I mean by not taking a chance is we don't want him to get outside of the house right now because he's kind of a little restricted with his movement. So as soon as he feels better, he's next in line. And yeah, my brother and my mom did get vaccinated. It was easy. It wasn't. I was a little scared that, you know, with listening to all the news, if it's not if it's going to be possible, but they had a good experience with it. They were able to get it easily.
Yeah, I would like to ask you. I'm sure for the benefit of the, some of the audience would want to know some of these questions that plague our mind on vaccinations. Um, there are people who've had the first dose and then contracted the infection. And they keep wondering about when to take the second dose, if at all, or to skip it totally. So just throw some light on this vaccination. And I'm sure you're encountering these questions yourself in the hospital.
Yeah, absolutely. So I was actually a little shocked when I heard mom said that her brother got vaccinated. Technically, we should not get vaccinated minimum for 45 days after contracting the infection, minimally, but I think that much time must have elapsed. That's the first thing. If you have contracted the infection, no matter what stage of vaccination you're at, you do not have to get yourself vaccinated for a period of 45 days because your body already has antibodies from the infection, no matter what the number is. And the vaccine can cause an adverse reaction and leading to clots, leading to severe symptoms of the illness as well. So we need a minimum period of 45 days of a break between the infection and the first, second, whatever dose of vaccine we're at. Now, many people think that the vaccine will work as a magic agent and it'll suddenly, stop us and prevent us from getting COVID. We have to understand that the vaccine takes minimally 9 weeks to reach its peak potency. So that's first jab, 7 weeks, 2 weeks more after the second jab to reach the potent level to protect yourself, or at least not become easily an agent of transmission, if I were to say. Now, a lot of people have been complaining about how, we got vaccinated and after 5 days we tested positive, after 4 days we tested positive, next we got vaccinated last week and I got positive. We have to understand that the vaccine is not giving you COVID. What has happened, especially in India, especially during this first 15 days of April, is that we were in, because we knew that there's a steep incline coming in, a lot of us, and the government opened the vaccination for everyone. There was a huge rush at the vaccination centers. Now, those vaccination centers became almost contained zones. They became hotspots of infection. So there were people who were carrying the infection asymptomatically. There were people who got sick for 2 days, and again, they did not get the RT-PCR down, or the RT-PCR was a false negative. And, they thought, oh, it's not COVID. It could be just anything else, just general cough, cold, allergies. And they ended up getting the vaccine. What that vaccine did is accelerated the severity of the infection in them. That is why we're reaching to a very this supreme high of infection that is there, is because people got infected at the vaccination center. And the vaccine is not like a jab that you put and you're suddenly COVID man and you have the shield on yourself. That's not the case. And see, because the vaccine has been developed in the last 1 year and it has to go through its scientific process, the longitudinal effect has to come in. We have to understand the vaccine is not a protection at all cost. It is just something that is guaranteeing a lesser severity of the illness. It might not protect you from the infection. There's a high chance that you might, if you are coming in contact with a COVID positive patient and all the atmospheres is in favor of you getting an infection, doesn't mean that suddenly you would not get infected. Yes, the chances go down severely, but if you're infected, the severity of the illness is something that is also there. That, for example, if you were supposed to go from a moderate to a severe infection, if you're fully vaccinated and at the epitome or the potential of your vaccination, then you'll just have a mild infection and you become much safer to the population. So get yourself vaccinated. And just one last point here is that if you think that you might be asymptomatically carrying, or if you're at any risk, my advice to everybody is that before getting the vaccine, 1 day before the vaccine, please get a rapid antigen test done so that you know that you're not carrying and you're not asymptomatic. Because the double mutant strain is also producing a lot of asymptomatic cases, or maybe there's a delay in the symptoms coming up. So the vaccine should not act as a booster to the infection. So wait 45 days post-infection minimally. Vaccine is not, a cure for the infection. It's just reducing the severity. And make sure you get a RAT done right before you get vaccinated.
What then are the first essentials when one discovers that he or she is positive, or somebody in the family is positive? What are the first essentials? What are the first things that one should do?
First essential, isolate that person, rule number one. Rule number two, if you're living in the same household, even if you have tested, if three people are positive and one has tested negative, do not assume that person to be negative. That is the major lapse that is happening. That person is probably asymptomatic, because the new variant, the double mutant, is also not showing up on the RT-PCR very correctly, to be honest. We're producing a lot of false negative at the hospital. We're seeing that the labs are failing in a lot of ways, or the testing protocols are failing, let's say that. So isolate the person, consider yourself to be COVID positive, block your WhatsApp. I can't say it in louder terms, because what is happening is that people are coming in and like forwarding stuff, and you're in a vulnerable position, or your family's in a vulnerable position, and you just, because you're so worried and you're so paranoid, which is absolutely normal. You're going to be like, okay, let's take steam also 4 times, let's have this card also, okay, let's just start this medicine as a preemptive strategy. There is so much nonsense in the name of research that is forwarded on WhatsApp, and it's always been there, but usually we don't mind it. But this time, at least in the last 2 months, I've lost patients because of WhatsApp knowledge. I mean, uh, because patients were like sitting at home and doing stupid stuff, because WhatsApp told them to, and they thought that's better than, even with my family, like, for my family, I had to convince them not to like listen to WhatsApp, and it can be so detrimental
Yeah.
There's something I would
and fatal. Not only detrimental and fatal,
uh,
it's
not able to hear you.
what
Yeah,
uh,
are you able to
Atul
hear
said
her?
today.
Yeah.
Yes. Oh, so all right, go ahead.
It's the stormy internet. And
Yes.
it's just that we have to, okay, so this essentials is, please do not over medicate, please do not take preventive steroids or preventive ivermectin, please don't load up on these multivitamins. These are highly toxic for your body. Please follow one doctor's advice. Please do not go into alternative forms of therapy right from the beginning. Let the situation be in control, let the virus you know um, have its impact. Don't dwell into alternative medicine. This virus is not meant for all. I'm all for alternative medicine, but not during this time, because I have seen people losing their thorax because they decided to steam 6 times a day, or drink like 5 liters of hot water, and they developed ulcers on their throats. Or I've lost patients in the ICU because they thought spelling camphor is a better idea to produce oxygen to actually be ventilated, because the mask is bloody uncomfortable. Sorry, pardon my language, but the mask is uncomfortable. So no WhatsApp, isolation, follow one doctor's advice, no preventive medicine. Please be mobile, don't be on the bed. You have to ambulate, you have to keep moving during the infection, don't be passive. So those are the primary things. And yes, the basic protocol, please measure your SpO2 and your fever every 6 hours. Please make sure that you're having all your medications in the right way.
Thank you so much. I mean, I cannot but end this webinar without asking one question that keeps coming back to me. I see my wife, trying to strike this work-life balance. I see all of you women, looking after the family and also trying to, put in their best. So let me begin with Poonam. Poonam, working for a healthcare organization, as all of us are. How are you doing this balancing act of looking after your family, caring for all these patients? The requests keep pouring in the whole day. I mean, I get so many phone calls myself. I can imagine what the CRM team must be going through, or what all must be going through.
So 2-3 things here. When my father fell sick, it was COVID second wave was at its peak, and it was a really rough time because the demand for nursing care had really increased for our company as well. So on one hand, there were these challenges where we had to ensure that patients and their families were getting care providers. And on the other hand, my father was unwell, and so there was a lot of conflict within myself that was going on. What should I do and where? But I would say that while everything was rough, and me, I would say Seva at Home was one of the best things that could have happened. And I'm fortunate that I was working for this company at that point of time, because when it got very difficult, I got in touch with my bosses and I told them that I need to take 3 days off. And the response that came was amazing, because my bosses came back saying family is important, you know. And so I was able to manage things, and I really, it really makes a difference which company you're working with and the philosophy of the people leading the team. So it's a work from home scenario right now for all of us. And I mean, of course, it is a tough time, not just for us as an organization, because we have to and we try to provide care providers to all the patients who are getting in touch with us, or all the senior citizens who are getting in touch with us. And because of COVID, things are difficult. But when things were difficult at my own home, I would say that, I wouldn't be able, I can't complain at all. And it worked out well for me.
Brinder, how will this pandemic change your travel back home when it is allowed?
Oh my God, immensely, I think. I often say we saw our whole travel world change post 9/11. And I think I'm going to say the travel world is going to change now too. I don't see myself traveling in an aircraft, as is our flights are like never ending, 24-hour long flight. And masks are not comfortable, but I think they are going to be a necessity. At least, all of us like-minded people who think masking is important. I don't think I can sit in a plane full of people without my mask, at least for a few years. I don't see myself going in an airport or traveling by train or anything. Even coming to India, I don't see myself shopping in the bazaars without a mask now. So yes, travel world, I think the whole world is going to be changed in a lot of ways after this COVID wave goes away, because it has changed us. It has changed our thought process. This is the first pandemic in our lifetimes that we are seeing, and we are going to see a whole different world out there after this. So yeah, I am scared to travel, but I will have to travel, and there is no other way. But I just have to be prepared for it. And I think if I'm already vaccinated, I'm going to mask up, I'm going to be careful. And life can't stop, life has to move on, but we just have to be careful. I think that's how we have to think.
In there, we were talking about home care, when you just had to leave a little bit. So now that you're back, you'd like to complete
Yeah.
that. How did your organization support you during this tough situation?
So the organization helped me in, like all my colleagues came forward to look for, all my everything that we needed, like I had messages, okay, talk to this one, maybe there is a bed available, or maybe, we'll get you an oxygen cylinder refill. I had so many of all of you all, trying to help in whatever way you all could, so I think all of you on this in this webinar right now, and I think I had, like Poonam was sharing, I mean, every time there's anything I call with and say, you know what, I don't think I'll be able to do it because of the current situation. Of course, without a second question, the next response I get from our leaders is, of course, family is important. You know, it's most important. Please go take care of your family, which has been a huge support. Because that's what helped me go back home and, you know, like get back to my family and take it. Like, you know, actually, I think it was displayed right now on this webinar. You know, my daughter was crying, Mama, and Atul was like, "Do you want to go attend to her?" So thank you for that. So I think this is how Seva at Home has been there for me. You know, I think, you know, like, you know, all of you on the screen have been my support. And to finish with that, you know, the home care thing, thankfully I think our third nurse turned out to be really good. And I think he turned out to be, you know, so he, you know, while he was there, we found a hospital where Dad could be shifted to, and he made sure he took Dad there. He went with everybody. He took Dad there, dropped him at that hospital with my husband, and came back. And the next day before leaving, he spent, you know, that night also he sat with Mom and comforted her. The next morning, he sat with her for a couple of hours, just chatted with her, because he saw how things were in our house, you know, and she's so attached to Dad. He sat and spent time with her, comforted her, and left. And he called and checked on Dad as well twice already. So it was, you know, he was really good.
Jaya, we're coming to the end of the program. I can't help but ask you, I mean, Jaya, because it'll help everybody. How does one calm the mind, you know, amongst all the stress and anxiety? And, you know, I mean, after some 70, 80 webinars, that answer should come so easily. But
The answer is easy, just not short, but I'll try to capsule it a little bit. The first thing is that we have to look for evidences that support our emotions. When I say that, I mean that sometimes when we're so overwhelmed, we start doubting ourselves, we start doubting our capabilities, we start doubting everything that we've done in life. So the first step is to look into every achievement that we've made and how we've, you know, come across many hurdles that must have come in our lives before that. Use that as an evidence and let that be the anchor point of your life to move forward. Second thing is, you know, learn to say no to yourself. It's like going on a mental diet where you're just, you know, telling yourself to shut up every time a bad thought is coming in. Okay, if the evidences are not working, that's what you have to do. You have to just tell yourself, you know, no, I'm not going to indulge in this thought. And then you know, as Brinda ma'am and everybody discussed, is like, find an activity that makes you actively relax. You know, do something that keeps you mentally and physically relaxed. Now, not necessarily a distraction. I am someone who's you know, I know the benefits of distractions are there, but I'm someone who's so against distractions because I just feel that they're not sustainable enough. But find habits that we can pick out on every day that help us relax, that help us be in touch with our emotions, be it a spiritual activity, be it anything, but we learn the ability to do nothing. And then sometimes what happens is that, you know, we get one emotion and it's an overwhelming emotion, or we're just feeling something and it's a bad emotion that we're feeling, and we let it spill across our entire day. And we let it affect our behavior, we let it affect our daily schedule. So the idea here, so for example, let me give you an example here, that I'm feeling I mean, I'm going to give like the most random exaggerated example, but I'm feeling really annoyed today. Rather than that annoyance spilling over my day, spoiling my mood, spoiling my relationship, not getting work done, I understand why am I feeling annoyed. It could be something as simple as that I really wanted to have a burger in breakfast, but I had to eat a papaya. So that's what spoiled my mood. And so I get a control over it and I don't let it spill over my day, don't let it affect my behavior, but understand my underlying emotions. that'll ease my conflict with my mind. And the way that we practice that, we start understanding the other person's underlying emotions, start addressing to what they are feeling, why they're feeling the same way. Get away from the superficiality of conversations, but understand the underlying emotions. And trust me, that's going to be such a big stress buster, because sometimes we're just so much in doing so less. So the idea is to do more and think less in a very short. That's 1 hour of webinar gone in like 3 minutes.
It's been a pleasure talking to you, ladies. And actually, thank you so much for the audience for being here with us and sparing your time for us. But I would of course urge you to be safe. Um, keep taking all the precautions that one has to. But I would like to invite Atul to say a few words at the end of this webinar. Atul, if you're there listening. Um, I'd like you to, end this with your message.
Sure. Thank you. Thank you, ladies, for sharing your experiences. Actually, this is definitely a tough time for all the families involved, and everybody is trying their best to be a good caregiver at home. And the message here that comes across by listening to all of you is that how we can be a good caregiver in the time of crisis. That comes first, right? You have to step up. You can't rely on somebody else to take your place and take care of your family. So you have to step up yourself and do the needful and be the best and reach out wherever the help is needed. So don't feel so stressed out that you don't reach out to anybody, because that's the only way you can do it. Because this help is out there, people are ready to help, but if you really don't reach out to anyone, then nobody will be coming out to you. So thank you. Thanks a lot. And hopefully, this message has really resonated with so many different people who are listening out here. And even if they take away one or two things as good tips to be a good caregiver for their family at home, I think that'll be well received. Appreciate it. Thanks.
Thank you so much, Atul. So let me
Thank you.
conclude and say by reading this from one of the attendees, a gentleman called Sumit Mudgal, and he's writing to all the panelists. And he says, thanks for the wonderful and informative webinar. It was very good to hear your experiences and tips on dealing with hard times. Wish you all and your families the best of health and lots of happiness. And Amit Kumar says, thank you. Nice. So thank you so much.
Thank you so much.
Thanks,
Yeah.
Sumit.
Okay,
Thank you,
for
Amit.
doing this. Thank you.
Bye.
Thank you, Atul.
Thank you so
Bye.
much, Sumit and Amit. Thank you
Safe,
all.
everyone.
Bye-bye.
Bye.
Bye-bye.